Are you suffering from pain on the inside of your knee, and do you think that it might be coming from Pes Anserine Bursitis? And are you wondering, what the heck is this thing? What kind of medical terminology are we talking about here? Pes Anserine Bursitis. Well, I'm going to explain this all to you in detail. I'm going to give you a thorough explanation of what Pes Anserine Bursitis is and why it's causing your inner knee pain. My name is Dr. David Midoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please subscribe to our channel so that you don't miss out on any of the helpful videos that we post every single week. Well, let's get into today's explanation. I'm going to tell you exactly what Pes Anserine Bursitis is, and I've got this drawing here to help me explain. So to orient you here, this is the thigh bones and the shin bones. Here's the knee joint, that's the kneecap right there. Here's the thigh bone and the shin bone down here. These three muscles that I've drawn in different colors all converge at the inside of the knee, and this green little circle sac thing right here is the bursa. Now, these muscles, just in case you're wondering what they're called, this is the sartorius muscle in red, the semitendinosus muscle in orange, that's one of the hamstring muscles, and the gracilis muscle in purple. The purple one is the groin muscle, it's an inner thigh muscle. All these muscles come together and their tendons kind of merge right on the inside of the knee, just past the knee joint line below there, and you have this bursa there that's designed to reduce the friction between all those tendons and the bone so that you can move your knee freely without the tendon rubbing against the bone or the tendon wearing itself down. So the point of the bursa is to reduce friction in the area so you can have the best possible motion. The bursa gets inflamed, that's why we call it bursitis. Itis means inflammation of whatever it's attached to, so bursa, bursitis, inflamed bursa. The bursa gets inflamed whenever there's excessive pressure on it, more than it's designed to take. It lets you know. So we have to ask the question, what the heck's giving this too much pressure? And I've written it over here. You've got short and tight muscles from the Pes Anserine muscles, the sartorius, the semitendinosus, and the gracilis. All these thigh muscles that attach here are too short and too tight, and they get like that for a variety of reasons, which I'll explain here in a second. But that pressure is what sets off the bursa. Now you might think, short, tight muscles, well, I need to go stretch them out. And that's what a lot of people will do, and that might give you some short temporary relief. But if you're looking for long-term relief, you really need to strengthen certain muscles and resolve the pressure issue, which I talk about in other videos, which I'll link in the description here so you can go check that out as far as like how to solve a bursitis problem like this. I'm going to tell you next the symptoms of Pes Anserine Bursitis. Some of the most common symptoms are increased swelling in the area, and you've got to know exactly where it is. So I'm going to show you on my knee where that is. If you look at your leg, and if you just hold your knee just like this and move your leg back and forth, if you just bend and straighten your knee, you should be able to feel the bones moving inside. Keep moving like this and slide your fingers onto the joint so you can detect exactly where the movement occurs. For me, it's right here. That's my joint line. So just like I showed you in the picture, that bursa is on the inside of the knee, on either side. If it's your other knee, it's going to be on this side. And then you've got to walk your fingers down under the edge of the bone where you can feel a little ridge there. That's where the bursa is at. If all of a sudden you're like, oh, I found it, you've got bursitis, you've located the bursa, and that's a good diagnostic tool. If you can poke the bursa and it hurts, you probably have bursitis. But the trick is finding the exact spot. There's a bunch of other things that could be hurting in the area, but the bursa is lower than the knee joint line. Stuff that could hurt the knee joint line could be the meniscus, the ligament right here, the MCL ligament, and there's muscles that attach near the area as well that could bother you. The cartilage itself of the knee joint, arthritis as well. And you could have overlapping conditions. You could have this bursitis problem with the meniscus problem or an arthritis problem. So just keep that in mind as well. Another common symptom is a repetitive motion that you've been doing. So if you've recently picked up cycling or running or some sort of cardiovascular gym exercise where you're moving your legs, consistently for a period of time, at least 10 minutes, 15, 30 minutes or more, and you started to develop this inner knee pain right at that area that we just covered, then likely you've irritated the Pes Anserine bursa. This does tend to affect younger people, so we're talking people like teenagers, people in their 20s and 30s and even 40s. Usually people that are older than 40s, people that are into their 50s, 60s and beyond, tend to get more arthritis-like symptoms and meniscus problems when it comes to pain on the inside of the knee. But it can certainly happen in somebody that's in their 50s, 60s, 70s and beyond. Personally, what I found is Pes Anserine bursitis tends to affect the person that starts a new exercise program. So somebody who's maybe not been as good at exercising over the past months, years, decades, and they start to get into exercise and they just overdo it. They feel good, maybe running or walking even, and they just go and they do a lot more than they thought they could do. And they tend to feel good at the beginning doing it, but several weeks into it, maybe even several months into it, they start to develop this inner knee pain, this tenderness, and potentially even swelling in the area. It's usually very focal swelling. When we're talking about meniscus or ligament problems, there's swelling all around the knee, on the back of the knee. With bursitis, swelling is just in that spot, the spot where the bursa is at. So if you found that you started to exercise recently, you're on the younger side, you're in your 20s or 30s, typically, you've got that swelling that's right there, and you've found your knee joint line and walked off the edge of the bone on the inside and you poked your bursa and it hurts, you can be pretty certain that you've got Pes Anserine bursitis. Now let's talk about the causes of Pes Anserine bursitis. The number one thing is overdoing it, as I just described. So if you think you overdid it, then good news, you probably just need to rest this, let it calm down, back off of exercising completely until it fully calms down, and then return to the exercise that you were doing very gradually. You might cut the volume of exercise you were doing in half to start. So in other words, if you're walking 5 days a week for 30 minutes at a time, maybe just do 15 minutes for 30 minutes at a time, or do every other day some version of that, so that you can reduce the amount of stress and tension to your muscles. Now that might solve your problem just like that, just reducing the amount of exercise that you do, and then gradually ramping it up over time. Say the next week after that, add a few minutes each day or add an extra day, and see what your body tolerates without increasing that inner knee pain, that Pes Anserine bursitis. Another situation that could be playing a role in your inner knee pain, in your Pes Anserine bursitis, is weak glute muscles and improper use of your glute muscles. It's not always that the muscles are weak back there. Sometimes it's just that you're not using them at the right time. And this sets you up for excessive pressure into the inside of the knee joint. Now let me just explain one thing here. I'm going to stand up on the table so that you can see my legs here. And that Pes Anserine bursitis, the bursa, is right here. So if your legs tend to collapse inwards like this when you walk, if you turn your foot in, if your feet are pointed in when you walk, or your knees tend to come together when you move, then that means that you're tensioning these muscles that I was telling you about on the picture, and you're adding more pressure to the bursa. But if you can turn your feet out when you walk or stand or run or whatever activity that you're doing, and be more glute dominant, use these butt muscles more, then it's going to put you in a position where you can turn your knees out and shorten the distance here, which makes the pressure on that Pes Anserine a lot less, and it saves your bursa. This is a condition called hip anterior glide medial rotation syndrome, which is big mumbo jumbo for you've got your leg coming inwards too far, and it's tensioning up all the inside of your knee. Everything that's on the inside of your knee is getting excessive pressure. This leads to things like MCL injuries, the ligament here, ACL injuries, arthritis, meniscus problems. It sets up a bunch of problems. It's likely just that the weakest link in the chain of joints and tissues in your body was that Pes Anserine bursa. That's what's falling apart first, what's getting hurt first. So that's the root cause of Pes Anserine bursitis. Now fixing it, there's a little treatment procedure that I've developed in another video. I've linked it here in the description. And you've got to set your expectations right. This is not something that just goes away overnight. It can go away relatively quickly compared to things like pain from arthritis or meniscus tear, more chronic conditions. this does tend to improve quite fast, more on like the weeks to month scales rather than several months to a year scale. So if you've been dealing with this Pes Anserine Bursitis for several months now, then that's just too long. You're not doing something correctly to address this problem. You've got to figure out the right treatment plan. Now go check out that video if that's you, or if you're just coming to this video right now for the first time and you just started having Pes Anserine Bursitis recently in the past few weeks here, jump on that video right away before it gets worse on you and you have it way longer than you should. I hope this video was helpful for you. Please give us a thumbs up and don't forget to subscribe to our channel so that you don't miss out on any of our helpful videos. Have a great day. Bye-bye.